Good morning. I'm John Woodrich, CEO of Bryan Medical Center. Welcome to Bryan's briefing on November the 5th. And I want to start out with just stating again, folks, please social distance, please wear your mask, and continue to wash your hands. Avoid those large crowds. We are definitely seeing a surge and a spread of this virus. I wanted to talk a little bit first before I share the numbers with you about anyone that feels they need to get tested. Remember, we have locations at our drive-through and also at our urgent care centers, and recently we've opened up a couple more urgent care centers in town, so you have 3 locations covering most of the city of Lincoln. We do only want people to come to the emergency department if they are showing those signs from shortness of breath and more acutely ill, so that we can start to manage the volume that's coming through our emergency department. And also with our urgent care centers, just for anything else that is non-emergent, please utilize those urgent care centers because it will help us deal with the surge or the volume that's coming through our hospitals. So I would encourage you, for those more minor type of illnesses, use the urgent care centers. Our numbers today, our midnight census is 568. We've tested over 29,696 individuals, 3,653 positives. We have 76 positive COVID patients in-house today, with another 12 that had been positive that are now negative, that are recovering, for a total of 88. We have 10 individuals in our intensive care that are positive, 31 in our progressive care, and 35 in our general care unit. We have 6 individuals that are on vents that are positive, and another 4 individuals that are still recovering that are on a vent that are no longer positive. With that, I would like to open it up to any questions that people may have in reference to what I just shared with you. I will share with you that is the highest midnight census I've seen here in this organization. But I give credit to our staff and the management in looking at this surge as it continued to progress. So we have had the capabilities to utilize additional areas. Also, if you recall, we are managing our elective surgeries that require an overnight stay. And as we put that into place last week, if you really think about it, as you reduce by 10%, it compounds each day. So somebody that may have a 3-day length of stay, so you have the effect on the first day, then the second day when you don't do those surgeries as well, it just compounds and frees up more beds for us. So that has been working well. We continue to monitor the point system that tells us if we should go to phase 2, and right now it looks like we should stay in phase 1, and we'll be doing that for an additional week. But I think all of you are familiar that you can only hold off some of these elective surgeries for so long. That's why we keep telling folks, please follow these directives. And this is something that we could really control and stop the surge from growing. So wear your mask, wash your hands, social distance. We can't say that enough. So please continue to do that. I will tell you, they have been very responsive to us. So as we have gone locally to the health department, as we've gone to the state level, to the governor's office, and just our mayor touches base with us as well. I will tell you, they have been very responsive to the healthcare systems. They're very engaged with us. I think the teamwork you're seeing happen across the state and in our regions where the healthcare facilities are working together, and it's not just hospitals, it's the long-term care facilities, it's anyone that provides healthcare services. I think you should be very proud of this community of what they've been able to accomplish. So right now I would say they're doing everything that they can do for us. We ask, and we want to make sure that we're not crying wolf on anything. We make sure that it is something that we truly need, and I think they understand that as well, and they've been extremely responsive. I will tell you, and we shared this before, staff are getting tired. We have brought in some more agency help, which has assisted us as well. Our overtime, staff are picking up as much as an additional 12-hour shift every 6 weeks as kind of a requirement. But then we have others that are volunteering more, and that just tells you a little bit about our staff. They're really stepping to the plate. We do monitor the hours because we also want to make sure we're creating a safe environment, and we don't want people to become overtaxed. So right now I think we're in pretty good shape. I would tell you the morale, the more that we can do to recognize these staff, I think the better. So I think Bob shared with you the other day of some of the things that the community has done, and we appreciate that a lot, the school systems, different businesses. We ourselves are doing a variety of things to try to keep that staff morale up, and we will continue to work on that. You know, from a leveling off perspective, I'm not sure we're seeing that from the cases. I honestly believe we're going to probably see a couple more weeks of this uptick. But if we could continue to control what people are doing in our communities, the better off we're going to be. So don't think that because it might level off a little bit, it could only happen for a day or two, and then you see another surge happen. So please be careful out there. We continue to open up additional beds. So most recently, we're in a conversation with a group of physicians that we have a joint venture in a center. And we're going to pause that for a period of time, and it's located at our West Campus, and use those beds, and it'll be an additional 8 beds for us on this campus. We've looked at another one of our areas where we're able to pick up another 6 beds. Our pediatric volume happens to be low, and this time of the year it typically is. We're looking at converting some of those rooms for adult rooms. So we're looking at a variety of options and continue to do that, and I think the people are very creative. But remember, just getting beds isn't the answer because you also have to find the staff to staff those beds. But right now, I think they're making every effort possible and responding to the needs that are out there in the community. I will tell you, these people are pretty sick. We're seeing that acuity go up, and that's why we keep giving this message to people. I think they think when they watch volumes go down a little bit, when that had occurred a month or so ago, that everything is okay and it's getting better. This thing's going to cycle and be with us for a period of time, and we believe this is going to be with us for months. This just isn't a day or a weekly type event, so be careful. And deaths, that definitely concerns us. That has an impact on our staff when they're taking care of these folks and they're so severely ill. I think one of the stats that you should look at is, I know you guys have been keeping track of this, is the media. Look at the number of deaths that occurred in this county from the start of this till about September 1st, and look at the number of deaths that occurred in the last couple of months. That is an indication that this thing is really pretty serious and people are more severely ill, and especially when it's hitting those folks that are compromised and our elderly individuals.